Turn your dial to cable 18. You will see the best in TV. Just talking with Tom. Just talking with Tom. Sit back and listen. You will hear the best conversation of the year. Just talking with Tom. Just talking with Tom. Just talking with Tom. Just talking with Tom.
Welcome to Talking with Tom. I'm Tom Dacey alongside Ed McCarver. Hello, Edward.
Hello, Tom. How are you tonight?
Good, good.
Oh,
back
very
in
good.
our friendly, kind funds of NHTV.
Yeah, the 1st of June. You know, I when we were shoveling snow this past January and February and December, I said, I swore I would never complain about the heat. I couldn't wait. Bring the heat on. But I broke that vow today.
It got pretty
said,
warm today.
Yeah, I found myself complaining about the heat, and I wanted to hit myself for it, but a lot of other people did it for me instead.
And of course, you had a big weekend this weekend in the McCarver household.
Yes. My stepson, Maureen's son, David Cunningham, tied the knot this weekend. So we went to the wedding in Mystic, Connecticut. Lovely day. Couldn't have gone more perfectly, if that's a word. Perfectly. It was an outdoor wedding, and the skies were a little cloudy, but wasn't raining. It was just a marvelous time. You know, when they got engaged last year, I said, we both said, oh, it'll never get here. And then it seemed to
fly by.
It flew by, and right now he's honeymooning with his bride Liana in Hawaii. So I don't know if we're seen in Hawaii, but if he is, hello, David.
YouTube.
And Liana.
There's always YouTube.
Yes, that's right. That's right. So we're happy about that, and it's also nice that the wedding's over. I have my wife back because you know, the pregame nerves and all that. I found myself a week before the wedding saying good morning to her, and her saying, you know, what do you mean by that?
I don't know if that's much of a prize for Maureen. She got the booby prize.
Yeah. I know. But thank you. It was a good time. We had a lot of fun, and best wishes to both David and Liana.
Congratulations.
So thank you.
But Ed, as I usually say at this time, have you done your homework?
Yes, I have. First time you've asked me if I've done my homework in many years, and I will not fail you.
With Ed's humor news, take it away, Goob.
All right, thank you, Tommy. A couple of dumb robbery stories to talk about here first. In Florida, a Florida man ended up behind bars after he attempted to pay a fine at the Bay County Courthouse using fake bills. John Jernigan was arrested and charged with 13 counts of using a counterfeit bill after he allegedly tried to pay a $400 trespassing fine with a collection of bills that had the same serial number. A courthouse clerk noticed that the $20 bills looked funny and alerted the deputy. When he was confronted, Jernigan at first claimed that he got the phony cash as pay from his employer, but later told police that he didn't know he had received the fake funds. At the time of his arrest, Jernigan had 26 counterfeit bills with him. Meantime, across the country, a Washington state robber who stole a woman's iPod and purse was arrested after he friended her on Facebook the next day. The 28-year-old man allegedly hit the woman on the head from behind in the attack at a ferry terminal at Port Orchard, Washington. His victim did not recognize the robber, but noticed a distinctive tattoo on his neck. The next day, the woman received a Facebook friend notification and recognized the sender as the robber. Police tracked the man down and arrested him. Kind of a nice story here. In upstate New York, 3 students found more than $40,000 in cash inside a second-hand sofa they bought from a charity shop for $20 and returned it to the elderly widow who stashed it there. The 91-year-old woman's relative had donated the couch to the state without her knowledge. The 3 students said they initially could not believe their luck at the unexpected discovery, but after seeing the woman's name on the envelope, they decided to make contact with her and return the cash. The widow gave the students a $1,000 reward.
Oh, nice.
It's kind of a nice story. Meantime, as a matter of fact, I'm going to end with this because this is goofy enough. Seattle police are looking for a man suspected of stealing the toilet tank from a restaurant bathroom as workers at a Subway sandwich franchise prepared his family's meal, police said. The man went to the Subway store in West Seattle with his family on Sunday evening. After placing an order, he entered the restroom and remained inside, even after his wife knocked on the door, asking why he was taking so long, and then left without him. When the man eventually emerged from the bathroom, he hurriedly exited the store in possession of a large plastic garbage bag. An employee who entered the bathroom discovered the toilet tank was missing. In addition, the bathroom sink was stuffed full of paper towels and still running, while the bathroom key was gone, police said. Subway workers valued the stolen toilet tank at $550. Witnesses at the scene were able to provide police with a description of the man, who remains at large. So if you see a man walking around with a large toilet tank,
Be careful when you go. Be careful when you go into Subway now, too.
Yes, careful. Hey, something I wanted to plug here, and it's something that we do every year. This Thursday, it actually starts tomorrow, but for North Haven, it's Thursday. The 2014 Law Enforcement Torch Run begins tomorrow in Connecticut. Now, the Torch Run will cover over 530 miles and run through more than 100 cities and towns. Now, over 1,500 law enforcement officers, invited guests, and Special Olympic athletes will be participating in the run. The final leg will end on Friday at the Special Olympic opening ceremonies held this weekend at Southern Connecticut State University. Now, the Torch Run will be in North Haven on Thursday, June 5th at about 9:10 a.m., where we'll receive the torch from North Branford at the town line on Route 22. The route will continue on Route 22, taking a right onto Route 5, where it will continue to run until handing off to the Wallingford town line near Wharton Brook State Park. And it's at that point where I'll be picking up the torch
with our good friend David Blakesley.
Yes,
right?
David Blakesley and several of Wallingford's finest will pick up the torch there at a little after 10 o'clock.
You've been doing this for how many years now?
Actually, I was trying to figure it out. I've been doing it since 1991. So,
oh, wow.
And each year they invite me back, which makes me feel good.
Which is unusual for you. You usually
Yes,
get asked to leave.
Yeah, yes, I do. But it's one of my. It's not really a race, but it's one of my favorite running events that we do, and it's for a good cause. The Special Olympic athletes, and they are great athletes. And the aforementioned Mr. Blakesley, an outstanding track athlete
Yes.
in his own right.
We've had him on
will
the
be
show
there.
previously.
Yes, good athlete and a very nice human being. So, and it was actually Dave that invited me back. So
We have a very special guest this evening. It's my pleasure to introduce this gentleman. I've had the honor of knowing him for over the past year. Please help me welcome Dr. Gordon Fosdick. Welcome, Dr.
Welcome.
Fosdick.
Thank you very much, Tom. Thank you, Ed.
Let's give him a plug. He is from the affiliated Foot Care Center, podiatrist to the layman. 2 locations, 15 South Elm Street in Wallingford and 470 Main Street. I put Middletown. It's actually Middlefield.
Middlefield,
that's
Middlefield,
correct,
okay.
yes. Yes.
So,
Well, thanks again for having
welcome.
me here, yes.
I want to start out by asking you, can you fill us in a little bit on your background and how you got involved in podiatry?
Sure. I grew up in Stony Brook, Long Island, and I was always involved in sports. And I happened to sprain my ankles or have some kind of foot injury. So I'd frequent a podiatrist, and I really enjoyed seeing what he could do to get me back on the field to play sports again. And it's something that it was nice to see that that patients really liked him a lot, that he was able to help me out almost immediately with some injuries. So that's one of the reasons why I decided to go into the field of podiatry. I was always interested in medicine, but I graduated from Stony Brook University. That was my undergrad, and then I decided to go to medical school, and I graduated from Temple Medical School in Philadelphia. And after that, then I did a residency down in D.C. for a few years. And then I decided to come up to Connecticut. And now I have 2 practices, one in Middlefield, as you mentioned, and one in Wallingford.
Which is the one I frequent.
Yeah.
Now, when you mentioned sports is what got you involved
Yes.
in this. When should one see a podiatrist? What type of symptoms? Is it just trouble walking, or a pain in the foot, or what are the telltale signs?
There's a myriad of issues that one can have, and if you're focusing on sports, there's a lot of injuries related to sports, whether it's in high school, elementary school. I see frequently soccer injuries, basketball. With soccer, oftentimes you'll see something called Seaver's disease. It's actually not a disease, but it has to do with your growth plates. And kids who are very active oftentimes will develop a heel issue where they have pain. And that's often diagnosed early on by a podiatrist, but someone, an athlete or the parents wouldn't recognize that as an issue where the child needs to be seen by a podiatrist, because there are certain things, simple things that we could do to alleviate the pain, and oftentimes it requires the diagnosis, and then we could get the child into right cleats. Could be the wrong size cleats, could be a biomechanical issue, but that's just one type of injury. But there's a myriad of there's tendinitis, Achilles tendinitis, which is very common with runners oftentimes too.
We'll get to that later on.
Yes,
I have a number of
you were telling me before that you're
An
quite the
avid runner
Yeah.
right here.
Yeah.
But there are quite a few sprained ankles, very very common issues where there's some ankle instability, and that you see frequently in basketball, but in all sports you can have ankle injuries.
Now, would you think if someone, say, sprained an ankle playing basketball, would that mean that something was wrong with their feet in the first place? It wouldn't be just coming down on it wrong, or?
It's not necessarily so. It could be a biomechanical issue where they do come down on it wrong, and then given the right circumstance, or actually the wrong circumstance, they truly turn their ankle, and that's when we could fit them for proper orthotics, and that's something else we could talk about. That's something that a lot of athletes use, and that's a device that basically is a prescription that I will take a cast of their foot, and then I mold a device, an inner sole basically, that will be a perfect mold of their foot, but it will balance their foot in the proper position. And they might need that. It could also be poor, the sneakers that they're wearing could be ill-fitting, could be the wrong size, not have enough stability for them. Yeah.
What does diagnosing foot pain involve?
Well, generally it involves looking at the different systems of the foot. It could be whether it's, as we were talking about before, tendinitis. With tendinitis, a patient will come in with a pain in a particular area of their foot, and I put them through a range of motion. I inspect their feet, palpate their feet, put them through, like I said, the range of motion, look at their biomechanical, the way they walk. I could see their wear pattern with their shoes. So that and then I also, if there is any inflammation, that's something that I will be able to determine. So there's quite a few things that go that are involved with diagnosing a foot problem. Mm-hmm. And it could also be skin. It could be that the patient has some irritation, even a callus, and that could tell you that there's a wear pattern that needs to be addressed.
We're talking with Dr. Gordon Fosdick from Affiliated Foot Care Center, and you can join in the conversation at 203-234-0025. We'll be here to the top of the hour. Any questions that you might have for Dr. Fosdick? Not counting athletics or the young athlete or the high school athlete, say someone well into their middle age, which limits most of the people in this room, and not counting the fact that I do run, but just someone, a sedentary lifestyle, in their 40s. What would cause, I know it's not much of a description, but what would cause their feet to have pain that's maybe want to see a doctor? Is there something that time does to the foot to injure it?
Well, there's overuse injuries. It could be that person works on hard surfaces. It could be a mechanic. It could be someone who works at Home Depot, is on hard surfaces all day long. Their feet actually, at the end of the day, and then over years, begin to become symptomatic. So
symptomatic meaning?
Symptomatic, painful.
Okay.
They could also have flat feet. And if they're on hard surfaces all day long, that's something that needs to be addressed. They will develop some pain, some symptom, something where they need to be seen by a podiatrist.
Do you find that that's the case, that someone...
Oh, yes, sure. And it could also be someone who's, like you said, who's sedentary, someone who's out of shape, someone that could be overweight, too. You think about it, your feet are your foundation. If you're overweight, everything is being supported by your feet. So at some point, you might develop some pain there.
Is it true that people with diabetes and arthritis develop foot pain?
Yes. With diabetes, it's kind of complicated, but there are some systems which are affected directly by diabetes, and one of which would be the nerves. Nerves, for example, are they don't work as well, the signal, and therefore people will have it. There's a disturbance in the signal, and people will develop burning sensations, pins and needles sensations, and it could actually be quite painful. Oftentimes it's in the middle of the night or in the evening. That's when they notice these pains, and that's called diabetic neuropathy.
I was going to say neuropathy. I know a few people that have that.
Yes. Now, you don't have to be a diabetic to develop neuropathy. It's just that 90% of the population that has neuropathy are diabetics. But it could also be related to exposure to heavy metals, like lead, mercury, poisoning. That could cause neuropathy as well. But that's something pretty serious, neuropathy. It's also something it's a progressive problem. It usually gets worse. Mm-hmm. And to the point where you become anesthetic, where you don't feel anything. Now you think, well, that would be good if I don't feel anything, because then I won't feel the pain that I have. But if you don't feel anything, then you could step on a tack
and not feel it.
And not feel it. And
has that happened?
Oh, yes.
Really?
Yeah, I pulled staples out of people's feet, needles, usually for diabetic needles, but all sorts of things, splinters, and they don't know that
they had no idea.
No idea, until they take off their shoe, sometimes, and they'll notice if they make a call to see me, but they take off their shoe and they see blood in their shoe. They have no idea how that happened, and then that's when they know they need to see a podiatrist. But that is something that leads to major problems. If you can't feel your feet, you could also lose balance because you don't know how much weight you've placed on one foot as opposed to the other. It's things that you take for granted.
Yeah.
But those people who have neuropathy, they will fall more frequently. And also, if they are diabetic and they have neuropathy, they could develop an ulcer. An ulcer is a wearing away of the skin. Now, if it's like a chronic opening in the skin, and they need to be seen by a podiatrist or a wound care specialist. But usually we are the ones that are the first to notice that. And that could be healed up. But also with a diabetic, their immune system is not as strong. So it could take them a lot longer. And also their blood supply to an area might not be as good. So they could have a circulatory issue with their arteries and veins and so forth. But yeah, neuropathy also causes, well, over 50% of all amputations are diabetic related. And they're diabetic related because of the neuropathy, and then there's something else called arthropathy, which is a vascular condition which occurs.
Wow. What are the best ways to prevent foot pain?
Well, I would say to inspect your feet, and that's something that people generally don't do. People don't give their feet any time of the day. Usually it's you just ignore your feet. Until
Feet get no respect.
get
That's what
no
you're trying to
respect.
say. So, all right.
Absolutely. So I think you need to evaluate, just like any other body part. When you're taking a shower, after you take a shower, you dry off your feet, and then if you see something, you're looking between your toes and make sure that there's no fungus and that's something at athlete's foot, that's a fungus, and certain things like that, you inspect it. And if you have any foot pain, then it needs to be addressed. You should not be walking around with pain. If there's pain, there's a problem, and that's when you need to see a specialist, a podiatrist, and then we'll be able to get you back pain-free.
Again, we're talking with Dr. Gordon Fosdick from Affiliated Foot Care Center. You can give us a call at 203-234-0025. Can you walk us through a typical foot examination? Is there a typical one, or does it depend on the symptoms involved?
It depends on the symptoms, because I treat from children to geriatrics, and a child oftentimes will come in and they'll have an ingrown toenail, or will have heel pain, as I mentioned before, or be flat-footed. So if they're flat-footed, then I'll take them through a biomechanical. I might take some x-rays and look at their bone structure. If it's an ingrown toenail, I generally will just take care of the ingrown toenail. But I will also instruct the child. It's not only children that have ingrown toenails, but I'll instruct the child and the parents on how they should be cutting their toenails. Now, if it's someone who has a sports-related injury, I'm going to go through a biomechanical, going to go through a range of motion. I'm going to palpate and take a look at their tendons. I'm going to most likely take some x-rays and look at the way that they walk as well, because that gives me a lot of feedback. I get a lot of information just by viewing the way someone walks up and down the hallway. And if it's a diabetic, I'm going to go through a different type of workup. I'm going to go through, most likely, as we were talking about before with the neuropathy, I'm going to see at what level of, do they have a diminished sensations. Because neuropathy, like I said, it decreases, their sensations decrease over time. And so there's a system in which I could determine how bad their neuropathy is. And it could be, I might do a nerve conduction velocity test. And that kind of gets a little complicated, but that tells me how fast the nerve signal goes from one area to the other area, if there's a diminished amplitude in the wave, and how long it takes. And that gives me a lot of feedback, and then I can determine what we could do for that particular patient to prevent it from getting worse down the road. And then I also check their circulation with especially with a diabetic, or in the elderly population, I'll check their circulation, make sure that they have good pulses, because there are, just like you have the carotid artery, or you check your pulse on your wrist. There's also a couple pulses that are very important in the feet, and if you can't feel those pulses, that's concerning. And then we might want to do a vascular study, and that's another way in which we could see how the blood flow. There's an arterial system of blood flow, and there's a venous system of blood flow. Oftentimes, I'll see patients that have swelling in their feet, and that's not because of an injury, but it's because of their circulation is very poor. So it depends. The workup depends on the type of patient and their potential disease that they have.
I'm just curious, you mentioned the very young and the very old. How old was the youngest patient?
I have treated patients, I've treated infants.
Really?
Yes.
Wow.
Where the parents are very concerned about maybe the way a certain nail is growing in. Also, with children, very early on, if you could address a problem early on, then you could rid the child of that potential problem that might manifest itself really badly later on. For example, some children have an in-toe gait, or their feet are pointing in, or they're pointing severely out.
Yep.
That might not correct itself when they get older. So that's when a parent would take the child to see me, and then I could say, well, yeah, we need to address it, or the child will outgrow that.
I was thinking of a funny story when he was talking about watching a child walk up and down the hallway. When I was younger, up at Shriners Hospital, I remember going in for an exam, and Dr. Fisher, who happened to be the chief of surgery at the time, was watching me walking my walker, and I was walking on my tippy toes. He's wondering why I was, and of course I'm not saying anything. Get out in the car, and I say to my mother and father, "Dumb doctor, the floor was cold."
That's funny.
I'll always remember that story.
Yeah, that is funny. But that you did, though, touch on something with toe walking.
Yeah.
And sometimes I'll get some parents who are concerned that their child is getting a little older and they're still walking on their toes. So, I go through the workup and see if we need to address anything or if there's any neurological issue going on. But certainly, if, as you asked before, with symptoms, when should someone see a podiatrist? Certainly, if you're having pain, or if you're having an itch, you have some rash, or you have a lesion, even a lesion on your foot. Lesion meaning, maybe like a freckle that you've never seen before. Those should not be on your feet. That's unusual. And I'm not saying that it's malignant, but no one knows what it is unless a doctor looks at it, and we might have to do a biopsy on it, which is very non-invasive, and it's a very simple procedure, and then we send it off, and then we know exactly what it is, and most of the time it's benign.
They always say that you should see your dentist once every 6 months. Would you like to see someone see their podiatrist once every 6 months?
That's a very good
overall
question.
health?
It depends on if they're a diabetic, more frequently than 6 months. If they're newly diagnosed diabetic, maybe every 6 months. If you're a diabetic who has some symptoms, the neuropathy that we were talking about, that's about every 2 months.
Okay. How about if you have no symptoms?
If you have no symptoms, you might want to check in occasionally. I don't think it's something that you need to be seen by a podiatrist. And unlike the dentist where they, I do think that, when you develop pain, that's when you should see. I know some doctors will say, well, you want to be preventative, but I don't think it's necessary, to be honest with you. But if you look at your feet and you say, well, I have very flat feet, and you look at the genetics of your family, and you see that mom and dad or grandpa, they're hobbling around, they have foot pain now, maybe you want to see me to prevent that.
So it is genetics.
Genetics, yes, it is. There are a lot of things with just like the way you look, the way your foot structure is also determined by your genes. And another thing that that I treat would be bunions, hammer toes, and these are all things that cause pain. And a bunion is a big bump on the inside of the foot where the big toe joint is, and that could cause a lot of pain within the joint and on the outside of the joint.
Now, if your parent had that, there's a chance that
Yes.
that could be inherited? Really?
Absolutely.
Oh, wow.
Yeah. It's genetic. Yeah. I mean, it's mostly genetic. But if you squeeze the women, if you're squeezing your feet into really high-heeled shoes that are extremely narrow, well, your foot is gonna it's gonna conform to that shoe. And that's another thing that we address. And like I said before, I'll do bunionectomies. Those are surgeries to correct the deformity, and that's when I would have to straighten the toe, and that would be done in the hospital. Hammer toes also, and that could cause a lot of pain, the hammer toes, because that's rubbing up. The toes are cocked up like this. Now, instead of straight like this, they're cocked up. Well, that's going to take up more room in your shoe. It's going to rub up against the top of your shoe. You're going to get possibly a corn inflammation. Corn's callus on the top of the toe. That's very painful. Oof. You can get calluses anywhere on your feet, and it feels like there's a stone in your shoe. And that's something that's simple that I could take care of, alleviate the pain with those patients. The patient will develop a corn later on. This is not a permanent fix unless I surgically take care of the toe or the bunion. But and that's another reason why someone might want to come to see me on a regular basis. It's kind of like some people develop calluses rather frequently because of their bone structure and the shoes that they wear. You develop calluses because of friction. That's the only reason why one will develop a callus. So if your shoes are too tight, frequently women are wearing shoes that they look good, but their feet are screaming later on. It's because it's very, very tight. Yeah. And if their toes are cramped up, then they're going to develop some callus, some pain, and that's when they come in to see me. And sometimes they'll come in once a month, once every 6 months, and that kind of dictates how frequently they'll come in to see me.
Again, we're talking to Dr. Gordon Fosdick from Affiliated Foot Care Center. You can give us a call at 203-234-0025. Looks like we have a little less than a half hour to go here.
It's flying by.
Yeah. You must have an opinion on high heels or flip-flops or when you see the fashions with the heels that are, they're like stilts.
Yes, yes.
that can't be, I would think, as a podiatrist. You must cringe when you see that.
Oh, absolutely. Yeah.
Or job security, one or the other.
Yeah. I usually try to sway them away from wearing those high heels, but it's a losing battle with many women because it will lead to some problems down the road. They're not going to recognize any problems now, and if they do, it's minor. But the longer that they wear those shoes, the longer, the more time to develop the calluses, to develop a foot that's functioning not the way that it's truly intended to function. So they oftentimes will develop pain under the ball of the feet. They'll develop calluses under the ball of the feet. Not so much heel pain because they really are not placing much weight on the heel. And so it's not evenly balanced, their feet. So I would encourage them not to wear, especially if they're having those, if they're presented with that pain, then I would encourage them not to wear those types of shoes.
How about flip-flops or sandals?
Flip-flops don't have any support. but they're not particularly bad to wear. They're bad for some people. And that's when the evaluation, when I look at someone's foot type, and I could tell that, well, they should not be wearing flip-flops. If they're flat-footed and they pronate, pronation is when their foot starts going out like this while they're walking, their foot structure is starting to collapse a little, and they're placing a lot of strain and tension on certain tendons, and that's a problem. And they should definitely not wear flip-flops. They need support.
Have you had to tell some of your patients that?
Oh, absolutely.
Oh,
because
really?
flip-flops are they're very popular.
Especially
and they're
this
easy
time
to put
of year.
on.
Especially this time of year.
Yes.
So,
So I would encourage, if they want to wear something like a flip-flop, they do have some flip-flops or a sandal that has an arch. And the arch support will help out that particular type of patient. So it's not across the board flip-flops are bad. It's for certain people, they should not be wearing them.
Because I see a lot of them every time I go out to the
Yeah.
store and whatnot. You see it, people wearing them all the time.
yeah, yeah, they are. Maybe it's not be the best thing for you. Let's talk a little bit about orthotics. We touched on it earlier, and on your website, you define orthotics as glasses for your feet, which I think is a great analogy. But talk a bit about that, if
Sure.
you could.
That way people can relate. They understand, because when I mention orthotic, it's foreign to most people. They don't know, oh, I don't want to wear those shoes. They don't understand it. It's not shoes. It's the inner sole that goes into the shoe. So I equate that with glasses, because glasses are prescription items. When you have your glasses on, you see better. Okay? With your glasses off, you don't see too well. So same thing with orthotics. They're a prescription item. I cast the patient's foot, and then I get the perfect contour of their foot. But then I take that mold and then I balance it to the position that their foot should be in while they're walking or while they're running. So it is absolutely a prescription item, and it only works when they're in your shoes. So just like your glasses, they're only working when they're on your face. So it's the same type of analogy. Patients understand that. And it's a simple device, and it fits right into the shoe. You have to make sure that your shoe has enough room for them. So you want to make sure that the shoe, you could take the inner sole out of the shoe, because most of the time there's an inner sole in your shoe.
Yeah.
So if you could take that out, then we could get the orthotic in, because it's about the same thickness as that inner sole. Might be a little thicker. And we could do an awful lot with an orthotic, depending upon what problem that they have. If they have an ulcer, like we were talking about before with the diabetic, where they're developing a callus and they develop an ulcer, well, why are they developing that? Well, it's their foot structure. It's the way they're walking. Well, if we could get them into an orthotic, we could offload, take pressure off of that area where they're developing the callus, then they won't develop an ulcer. And they'll be walking relatively pain-free. So there's a lot of things that we could do with orthotics. I use orthotics a lot with athletes. People don't realize that an athlete, although they're in excellent shape, they're pounding on their feet.
Yeah.
They're running around doing all sorts of exercises and so forth. They're putting strain on their feet, on the tendons, on the ligaments, on the bones, and they might need some support and actual something that goes into their shoe, which will put them in the right foot position to take pressure off of those tendons and ligaments and so forth. So that's where the orthotic comes in handy.
Now, do you also do braces, like if somebody needs a brace?
I do. That's a very good question.
Because when you were talking about that before, I remember when I wore I think they called them AFOs at the time.
Yeah, yeah.
Just what you were saying, the cast of the leg and doing the mold that way.
Yes, I frequently use those on patients with, sometimes they have ankle instability, or, like I said, their foot is pronating tremendously, and an orthotic is not sufficient, then I will do an AFO, an ankle foot orthosis. That's what AFO stands for. So that gives you more support. It's an orthotic, it's a beefed up orthotic. It's an orthotic with 2 stirrups on the side.
Yep.
And that holds up the foot, gives much more support. So yes, and then sometimes I'll even use a brace for patients who have drop foot. Drop foot is when they lose certain muscles are not engaging anymore. So when they're walking, their foot is slapping while they're walking. So they can't bring their foot back up while they're walking. So they're dragging their toes.
Yep.
So the brace will spring spring the foot back up every time that they take a step. So there's a lot of different types of braces that are used. But the AFO is a very popular one. And actually, we use AFOs with athletes too.
Which, in your practice, which sport, which athletic event brings you the most patients? Is it runners or is it
That's a good
other
question.
sports?
I would say any sport where you're running a lot. So therefore, I see a lot of patients, and it depends on, it's seasonal too, because not all sports are played all season, all year round. So
Football?
football, I do see quite a few patients with football injuries, but soccer is a sport because
Running
we're
and
constantly running. I'm seeing right now, I'm seeing a lot of lacrosse injuries. And that's another sport where you're running around a lot.
A sport that's getting very, very popular, I think, at all levels.
Yes, yes. Growing up on Long Island, it was huge, and it still is huge. But it's interesting how now Connecticut is definitely becoming
It's
more,
evolved, yeah.
Yeah, it's definitely evolved. And it is a great sport. I enjoyed it. I played it myself. But I played college, too. Yeah. As far as other sports, well, running definitely. And running is one of those sports where I see a lot of injuries because when people want to get back into shape, oftentimes I'll see, or they'll tell me that they're getting back into running. They could have just started picking up running for the first time in like 20 years, and they're several pounds overweight, and they think that this is how they're going to lose weight. The problem is that a lot of times they're way overweight, and every time that you're running, that's 3 times your body weight coming down on each foot. Because you're unsupported. When you're running, your 2 feet are off the ground at times, right? Because it's not like walking where your feet are on the ground. So you're pounding on your feet. And if you're overweight, trying to lose weight, it's almost a guarantee they will come back with foot pain or knee pain. And they will have to stop their exercise. And they're not going to lose any weight. So that is probably an exercise. I would say stay away from running if they're significantly overweight.
You don't have that problem yet.
No. I was thinking maybe something like an elliptical or something.
Elliptical,
you'd
exactly,
recommend.
yes.
So
Yeah.
it's not that pounding on the joints. I
Yes.
wanted to ask what you thought of barefoot runners.
That's a good.
And
that's
I
a,
see more
yes.
and more of them out there
That's
now.
becoming popular.
That's dangerous, isn't it?
Well,
I think it is, but
there's 2 sides to that. And it's funny that you mentioned that because I have a good story. One of my older brothers, he's an attorney, and he lives down in Virginia, and he's into barefoot running. He's got the Vibram 5-finger. Yeah, so
Yes.
he came out to the house, and he's you have to try these out. He's trying to convince me that these are great. And I tried it out. It was very interesting. It's a different way of running altogether because you're running on the balls of your feet all the time. So while he's telling me this, he's trying to make a good pitch for how great this is, he's hobbling. He's actually hobbling. I said, well, what's going on? And his wife is even laughing. Like, she's like, you're an attorney, you're trying to make a case for yourself and you're hobbling. So that's only one case. But he actually developed tendonitis, which I diagnosed. He didn't realize that he had it, but it was tendonitis from overuse, engaging certain muscles and tendons while running, because you're always running on the balls of your feet. You don't heel strike with the barefoot running. The problem with that is that you're placing, you have to train for that. You have to build up slowly, very slowly, because your whole life you're walking heel to toe. And now you're running just on the balls of your feet. Yeah. So the verdict is not out. I'm not a fan of it. I've seen stress fractures of the long bones of the foot, which are the metatarsals.
Yep.
And they're the ones that receive the bulk of the pressure. And I've seen quite a few of them. And I don't know how many people are running full marathons barefoot, but I'm not a fan of it.
Running marathons in general, as a podiatrist, would you recommend
I understand certain people get a tremendous high from it. You have to have the right body type for running without straining your knees, your hips, and your joints, because it's a marathon is quite a few miles, and it's repetitive over and over again. So I think over time, some people do develop some wear and tear on certain joints. So that's why it's very important, I think, you need to be evaluated, making sure that you're wearing the right sneakers. You might need orthotics and so forth, because people oftentimes just go to the shoe store and they go to the shoe store and some, high school dropout is handing them,
somebody
sneakers.
not trained.
Yeah, someone not trained. Yeah. You have to go to a good running store, because they will be able to evaluate your feet and say, they could take a look and say, these type of sneakers, New Balance or Asics or Saucony or whatever, this is what I recommend. But oftentimes people are just throwing on whatever shoes that they have, sneakers that they have, and they're running, and that's a recipe for a problem.
What sport? And again, we're talking to Dr. Gordon Fosdick, podiatrist. What sport is easiest on the feet?
I haven't thought about that.
I know.
Oh yeah. Well, another sport that's difficult on the feet, and I see quite a few are girls with dancing. That's another. When they're dancing, they're oftentimes on the balls of their feet. They oftentimes will develop some issues down the road with the shoes that they have been wearing with ballet or whatever. But easiest on the feet, maybe bowling. I don't.
As a runner, they said to fix the joints, they said swimming was.
Oh yeah, actually I think probably swimming. Yeah, that makes a lot of sense. Yeah. And I don't treat. It's funny. Swimming is very easy obviously on the feet, but I do treat a lot of warts with swimmers, and that's another condition that podiatrists will see. And with children, especially with children with warts like damp environments. So swimming is ideal environment.
Yeah.
Can you explain a little bit about rice therapy?
Oh, sure. Rice therapy, RICE, is you rest the injury. This is with an acute injury, meaning that it's a fresh injury. You're going to rest it. You're going to ice it down. And icing, you basically want to ice it down, take a bag of ice. You could even take peas in the freezer, and you could use it. Put it on for about 20 minutes on, and then 20 minutes off, and then 20 minutes on. But the first 48 hours, the first 2 days is imperative to do the ice therapy. And then you have the C part of rice, would be compression. So you want to put something on there that will prevent the swelling. So a tight sock, elastic wrap, ace bandage type of thing. And then you have E, which would be elevate. So you want to keep that body part, the foot, elevated over your heart. So then you don't get the swelling, because swelling causes a lot of pain. So that's with acute injuries. With something that's chronic, that's not going to work as well. So that needs to be addressed in a different manner.
Okay, we've only got a handful of minutes left, I
the
think.
time
You know, I
flew
don't
by.
have my earplugs, so
Time flew by.
our crack staff,
Yeah.
who normally would be out, will probably come out. Eric or Nick will come out and tell us how much.
But I do
How
have
much time is left? And even as we speak, is like 8 minutes? Eight minutes. Okay.
I do have something that I could talk about
Yes.
as far as we were just talking about acute injury, and that's with RICE therapy, the rest, ice, compression, elevation. But if someone has a chronic injury, and oftentimes a chronic injury could be something like plantar fasciitis. It's something that I see day in and day out. Plantar fasciitis is inflammation and pain of a ligament in the foot. It's mostly heel pain. When someone says, I have a heel spur or heel pain, that's generally plantar fasciitis. And if someone has had it for 2 or more months, it's really become a chronic injury. It's no longer acute. It's not a fresh injury. So we do have a therapy that I have brought into the practice, and I'm one of only a handful of doctors in the state that has this. It's pretty high tech, and professional sports teams have it. It's shockwave therapy. And what we do is we create, it's non-invasive, and we create a new injury, so to speak, where the chronic injury was. So a chronic injury is something where the body no longer recognizes the pain. Or it no longer recognizes the injury. There's still pain, but doesn't recognize the injury. So, because there's a poor blood supply with a lot of ligaments. So what we do with this EPAT, that's the shockwave therapy, is we pinpoint where the problem is, where the pain is, and then we create a new injury just in that area. So now all the good blood in your body, the growth factors in your blood, the platelets, all of that good blood goes to that new injury, and now you start the healing cascade. And like I said, the professional sports teams use it because they don't want their million-dollar athletes sitting on the bench not playing. It's non-invasive, and it's a relatively pain-free procedure, and it gets athletes up and running relatively quickly, a lot faster than traditional therapy. And they can actually train at 50% level, which is an issue with a lot of athletes. They just want to get better. And they don't want to, athletes are very difficult to treat because they just, they want the quick fix. And this is something that really will be as close to a quick fix as possible because they can actually continue to compete, but at 50% level while they're having this procedure done. And generally it takes about 3 to 5 treatments, and each treatment's about 10 minutes long.
Do you treat Achilles injuries?
I do, and I use this particular, the Shockwave, the EPAT machine for Achilles tendonitis. Achilles is common with certain people at certain sports.
I know as a member of the running community, over the years, they used to say if you lose an Achilles, you're on the shelf for almost a year.
Oh, absolutely. And if you rupture an Achilles, that'll ruin your career.
Has that ever happened to you, Ed?
No. I've had Achilles pain over the years, and I back right off.
Oh, yeah.
I know it's...
Tendons and ligaments take a long time to heal, and the reason being is that, especially on the feet, because you're walking. It's not like you throw your foot in a sling. You have to get around.
Yep.
So tendons and ligaments take a long time to heal on the feet, and they also have a poor blood supply, like I was saying. That's where this particular therapy comes in handy. Another thing that also we treat is unrelated to sports injuries, but I see a lot of it, is fungus on the nails. People who have unsightly nails, the thick nails, and a lot of runners will get it because they're pounding while they're running. Fungus likes areas that are dark and damp, your sneakers and shoes, and traumatized areas. So when you're running, you're actually causing little micro traumas, little blood vessels under your nail.
Black toe.
The black toe, yeah.
Yeah.
So that's because of blood getting underneath the nail. Well, that's the perfect environment for fungus. So fungus sets in, and people get these thick, unsightly nails. And we also treat the fungal nails, whether it's topically, orally. Sometimes I'll place a patient on an oral medication, but I also use laser. And laser is up and coming. It's the latest therapy, and it works really well.
I know we were going to touch on laser therapy, but I know that the time is short.
Yeah.
I had one fast question for you,
Sure.
and we talked about it before we went on the air. Your thoughts on yoga?
Yoga. Yoga is very good. I do like yoga. However, some people overdo it. What I mean by overdo it is they overstretch, and then they could cause problems
Phone call?
with tendons and ligaments.
We have a phone call.
Okay, and I
Quick.
think we have a phone call here.
Oh.
Hi, you're on Talking with Tom.
Yeah, Tom, I was wondering if there's any way we could find out where this doctor is located.
Oh, sure.
sure.
Yes, I have two practices. One is in Wallingford, and that is 15 South Elm Street in Wallingford. That's pretty close to the Y. There's the YMCA right on that street. And then I have another practice in Middlefield. And
Okay, do you guys have like family plans or?
I do treat lots of families.
Yeah, like can you bring the whole family in at like one appointment type of thing, or?
Sure. Yeah.
Like, you know, when the husband works different hours than the wife, and
Yes.
they need to wait for the husband to come home and the children to get out of school or camp in this case because summer's coming.
Yes, I do. Yes. I do have quite a few families that come in, and I'm treating, you know, the children and the parents.
Okay.
Yes.
All right, and how long does it usually take to get a booking in?
Well, each appointment generally is about 20 minutes long. However, to get an appointment with my practice, if it's an emergency, I can get you in immediately. I don't know how far out I'm booked, but you could certainly call the practice, and I could give you. I'm sure the station will give you some.
Yeah, I could forward the information.
Forward the information.
Okay, so if we contact the Talking with Tom show, they can give us further information.
Yes.
Yeah.
I appreciate the phone call. Time is short, but we appreciate it. Thank you.
Okay, thank you. You have a good night.
Yeah, bye now.
Thank you.
Bye-bye.
Can you plug your website?
Sure.
Or if you just
it's,
Google
yes,
Dr. Gordon Fosdick?
Yeah, Dr. Gordon Fosdick, yes.
Okay. To get all the information. That's an excellent question.
I want to thank Dr. Fosdick for joining us this evening. I know time is short, but don't touch that dial. In a few moments, I'll be joined by Jay Williams and John Zimmerman, so stay tuned for the Squared Circle. Thank you, Ed.
Thank you.
I haven't treated too many professional
No wrestlers yet. All right. Well, this may be a first. Stick around. Maybe.
Want to thank you for joining us, and we will be back with Talking with Tom on the first Tuesday in July.
Okay.
Good night, everyone.
Thank you. That was fun. Yeah.
Good. Did you
enjoy it? Yeah.
Good.
Yeah, no problem with the.
Just talking with Tom. Just talking with Tom. Turn your dial to cable 18. You will see the best in TV. Just talking with Tom. Just talking with Tom. Sit back and listen. You will hear the best conversation of the year. Just talking with Tom. Just talking with Tom. Just talking with Tom. Just talking with Tom.